The reason for the muting folks is because I want to kind of get through the information as quickly as we can. Most folks that are going to be on the webinar with us tonight are patients. So my encouragement to you is, if you have questions, go ahead and jot them down. We can talk about them on a future visit. I want this to be a little bit more than an academic presentation. I want you to be able to have some action steps to take. With that being said, there is an academic portion to it. So if you don't have some notepad, maybe a pencil, something like that to jot a few things down, I'd encourage you to go ahead and grab those because we're going to be looking at some specific steps that you can take on your own as well. But again, topic is seasonal allergies. So let's go ahead and get started with that. I wanted to kind of introduce myself first. Oops, too many screens. There we go. As most of you know, I've been in practice, private practice here in the Nashville area for 25 years. Next month, if I give this seminar next month, then I'm going to have to change that to 26 years because April does mark 26 years of practice for me. I have been able and been blessed with caring for thousands of folks. If you've been in the office, you've seen it from teeny tiny babies all the way up through senior citizens. A lot of folks don't know that I'm actually in a little bit of bragging, maybe. I'm a national speaker, instructor for the MC2 chiropractic technique. I've traveled to several different states to teach other chiropractors about the technique that I use here in this office. I do prefer a simple approach to health. Master the basics before you try to complicate things. Master the basics. My kind of driving force, if you will, my little mantra: healthy habits lead to a healthy life. That's what everybody wants. Everybody wants a healthy life, but they don't realize that the healthy habits that we establish in our day-to-day routine are what then leads to a healthy life. So healthy habits lead to a healthy life. I want you to remember that because we're going to talk a little bit more about that later on in the program as well. So since we're talking about seasonal allergies, I just thought let's just get a good definition of what seasonal allergies are. So you can read it right there. It says, according to the American College of Allergy, Asthma, and Immunology, seasonal allergies, like other types of allergies, develop when the body's immune system overreacts to something in the environment. It's, of course, usually during spring, summer, or fall when certain plants pollinate. If you think about that definition right there, that's kind of a what. In other words, it answers the what question. It does not answer the why question. And that's what I want to talk about tonight is why does your body overreact when those certain plants pollinate in the spring, summer, or fall? And this is a little bit of what you're going to get tonight. I'm sure you've seen this picture before online. I've seen it on Facebook many times, or at least a variation of it. Both of these gentlemen obviously are looking at a number, but depending on their perspective, they're seeing a different number. So what you're going to get tonight is a different perspective on how you approach the, if you will, treatment of seasonal allergies. There's a big difference between traditional Western medicine and then holistic type, chiropractic type, natural approaches, if you will. Both schools of thought are looking at the human body. So just like these two gentlemen here are looking at a number, both traditional Western medicine and chiropractors are looking at the human body, but we're looking at it from a slightly different perspective. That perspective being the difference between mechanism and holism is what it basically boils down to. Mechanism, which is what traditional Western medicine is, looks at the body as pieces and parts. In other words, they look at one particular system or one particular part of the body. Holistic medicine, chiropractors, as the name implies, looks at the whole body and how these systems integrate together, not just individual systems, but how they do work together. So holism versus mechanism is really what we're going to be talking about tonight. And this picture is a great way to think of that. Looking at the same thing, but looking at it from two different perspectives. So let's talk about those two perspectives. From a holistic standpoint, the two causes of seasonal allergies, there's two primary causes. Number one, your body is not properly communicating with itself. Therefore, when those invaders, those pollens, those seasonal allergies or seasonal allergens hit our system, we can't properly recognize them, and we cannot therefore coordinate a proper response. What this basically boils down to is this is what I call the domain of the nervous system. Excuse me. Your nervous system is the system that interacts with our environment. If you don't know that it's 20 degrees outside, if you can't detect that it's 20 degrees outside and therefore make changes to combat that cold, you're going to freeze to death. If you don't detect and react to the stresses in your environment, whether those stresses are seasonal allergens, whether it's the temperature, whatever it is, if you don't detect and react to those stresses correctly, then you're not going to be healthy. That's where chiropractic fits into our discussion tonight, is through the nervous system there. And then secondly, the other cause is that what I say is your body's internal environment is already in overload. This typically is a result of the choices that we have made through our different lifestyle habits that we have. Back to that, healthy habits lead to a healthy life. Well, the opposite of healthy habits leading to a healthy life, unhealthy habits lead to an unhealthy life. That's pretty obvious if you think about the reciprocal being true. So if your body's internal environment is already in overload because of the choices we have made, what choices are those? In the case of seasonal allergies, it does primarily boil down to what you eat, to your diet. Most people don't realize that their diet can affect their seasonal allergies. They can actually make them worse. And we're going to talk about that tonight. So my approach when I'm taking care of my patients, when we talk about seasonal allergies, I call it a three-pronged approach. Prong number one has to be care of the nervous system, because your nervous system I'm going to say this probably 10 times tonight. Your nervous system controls and coordinates the function of every cell, tissue, and organ in the body. You have to have a properly functioning nervous system to maintain any level of health. That's foundation number one, or the first prong to the three-pronged approach that I have. Prong number two is cleaning up your diet. We're going to talk about omega-6 fatty acids versus the good omega-3s, the foods that cause inflammation, and then something that's called leaky gut syndrome. We're only going to touch on leaky gut syndrome because honestly, I can do a full hour. The last seminar that I went to on leaky gut syndrome, we spent 8 hours just talking about it. We're only going to talk just a couple of minutes about it because it's a pretty deep dive, but I think we can cover some of the high points tonight. And then prong number three is once you go through 1 and 2, there are some supplements that you can take that will help your system during the particular periods of overwhelm to help kind of control some of those symptoms of seasonal allergies. So let's just dive in with prong number one, your nervous system. One of the basic premises that I like to teach is that you live your life through your nervous system. Some patients, when they come in here, they're a little surprised that as a chiropractor, I don't take x-rays of their bones. Well, we don't live through our bones. If I did take an x-ray of some, or if I, let's say that I had an x-ray and I showed it to you, you wouldn't be able to tell me whether that was an x-ray of a live person or a dead person, because we don't live through our bones. We live through our nervous system. And so again, with the nervous system controlling and coordinating every function of every cell, tissue, and organ in the body, that includes our immune system. So there is a neurological impact on allergies. The basic premise, if you will, behind that is, how do we know what allergens are in our environment? So when we breathe in those allergens, how do we know which allergens? That's what the nervous system does. If the nervous system can detect those different allergens as they're going into our system, it can then coordinate the correct response as opposed to the over response that was in that definition that we started tonight with. If it doesn't detect it, the best way I've learned to describe to help folks understand what we're looking for with chiropractic care is what I call poor cell phone reception. We've all been there where we've been on a phone call with somebody and we can't quite hear them. Either the phone reception staticky, or maybe we're just in a bad spot and it kind of cuts out for just a little bit. You're still communicating with that other person, but it's not an efficient system. You keep saying, what? Huh? Could you repeat that? If that's happening in your nervous system, let's say between your brain and your sinuses, the two body parts aren't communicating correctly, then there can't be a proper response for that, and you're going to over respond usually because the brain says, well, I'm not exactly sure what's going on, so let's send in everything. And that's what typically causes the sinus infections and the inflamed sinuses and everything, is because of the overreaction, because the brain doesn't know exactly what's going on. That poor cell phone reception comes from the spinal misalignments that we adjust when you're in the office. That's what chiropractic adjustments are designed to do, is it's designed to help reestablish the communication between the brain and the different body parts down in your body. On top of that, the immune system does receive support from the nervous system. Most of us have heard of what are things, they're called neurotransmitters. They're chemicals, is what neurotransmitters are. When a nerve ends, let's say that my hand here is the end of a nerve, as the signal comes down to the end of the nerve, that signal then gets turned into, if you will, the electrical part of the signal gets turned into a chemical, and then that chemical is released from the end of the nerve, and that chemical then goes to either another nerve or maybe a muscle or an organ, or in this case that we're talking about tonight, it actually goes to the immune cells, the white blood cells that are floating through your bloodstream. Research has found neurotransmitter receptor sites on our white blood cells that are in our bloodstream. So our nervous system talks directly to our immune system that's floating through our bloodstream. On top of that, I've got thousands of testimonies of patients through the years who have matter of fact, one of my last patients this evening had a dramatic turnaround in her sinuses. On her first visit, she could barely breathe through her nose. And not bragging about me, but about chiropractic, 2 visits and her sinus allergies are gone. She just breathes freely through her nose now. So I've got thousands of testimonies like that, just proving how much the nervous system affects our immune system. On top of that, chiropractic care just in general reduces stress and inflammation in our body. Well, chronic stress keeps our body in our fight or flight state, and when it does that, your body doesn't know what's going on, so it sends in the Marines, if you will. It sends in everything it can to fight just all of the stuff, including even just the littlest bit of pollen that comes in through our nose. So that fight or flight state causes our body to overreact to things. And then allergies, if you think about it, when your sinuses are inflamed because of allergies, that is inflammation. We don't think of it like joint inflammation that causes pain or anything like that, but it's still an inflammatory process. Well, chiropractic care helps reduce inflammation in the body as well. So that's prong number one. Well, I forgot about this slide right here. This is an interesting study. Some people may be thinking, well, chiropractic care in your immune system, is that something new? No, I mean, look at this study. It was published in 1993. That's the year that my wife and I got married. So 30 plus years ago, they found that the chiropractic adjustments affect the immune system through the T and B lymphocytes. That's the white blood cells that we were just talking about. The natural killer cells, that's with cancer fighting right there. Antibody levels, phagocytic activity, plasma beta, endorphin levels, all of those are affected, positively affected through chiropractic adjustments. So like I said, that's prong number one. Moving on to prong number two, we're going to talk about cleaning up the diet and then the different supplements that we might be looking at there. So when we talk about cleaning up the diet, one of the big ones that I encourage you, and then fortunately for you, this is a little bit of an easier one for to do. Watch out for your vegetable oils. Vegetable oils are high in omega-6 fatty acids. Those omega-6 fatty acids break down to a chemical called prostaglandin E2, and prostaglandin E2 promotes inflammation. As I already said, sinuses, when you're having an allergy attack, your sinuses are inflamed. Everybody knows that. But also think about the different types of inflammation in our body. Arthritis, that's a type of inflammation. So omega-6 fatty acids, vegetable oils can actually affect arthritis. Coronary artery disease, when you've got plaquing of the arteries, that's an inflammatory process. There's inflammation inside of your arteries that's caused by omega-6 fatty acids. So by limiting your ingestion of omega-6 fatty acids, the vegetable oils, then you're going to limit them breaking down to prostaglandin E2, and therefore your body's not going to be producing as much inflammation without that prostaglandin E2 in there. So that's Fairly easy step to do. Just watch your vegetable oils. On top of that, dairy products and gluten also cause an inflammatory and mucus response in our digestive system. When I say gluten, for those of you that don't know, anything with flour has gluten in it. So breads, pasta, pizza crust, cookies, cake, anything with flour has gluten in it. Dairy products and gluten both cause an inflammatory response in our body through a different breakdown. It doesn't break down to prostaglandin E2. It does a different chemical pathway. But when that particularly dairy products and the gluten hit your digestive system, your body reacts by producing extra mucus. Well, guess what's going on in an allergy and seasonal allergies? We've got mucus going on here. So if you're producing extra mucus in your gut already, and then you breathe in some pollen, and it's easier for your body to produce more mucus. How many more times can I say mucus tonight, huh? And then on top of that, the other thing that I want to mention tonight, of course, is the leaky gut syndrome. Here's a little visual for you. This does a great job actually of giving you an idea of what leaky gut syndrome. I want you to remember that your gut is a tube. So if you can see my hands here on the camera, your gut is a tube. What we're looking at is the layer of tissue that's just inside the tube. That layer is kind of what we're looking at right here. And it's on the microscopic level. So those cells in your gut lining need to have what's called that normal tight junction. They need to be smack dab up against each other, just like you see on the left part of that picture. As food particles travel through our digestive tract, the body kicks out the enzymes and digestive juices and all that kind of stuff, begins to break down those food particles into the nutrients that we need. Those nutrients, again, in a good, healthy gut, the normal tight junctions, those nutrients are then absorbed through the cells and into the bloodstream. In the case of a leaky gut, and you may be thinking, well, do I have leaky gut? Statistics show that about 80% of adult Americans have leaky gut. So there's a very good chance that you have some level of leaky gut. What causes it? That's a whole nother thing that we could get into later. But there's a good chance that you do have it. When you have leaky gut, we don't have that normal tight junction anymore. The cells have separated just a little bit like that. And instead of the nutrients being absorbed through the cells, actual food particles, pollens, viruses, bacteria for that matter, can slide through the gut wall and straight into your bloodstream. Well, then when it's in your bloodstream, then your immune system recognizes it and sees it, and it launches a nuclear attack. This is where a lot of food allergies come from. That extra mucus production we were talking about comes from something like this as well. It promotes a ton of inflammation when this happens, because that's what your body does to an invasion. Is it causes inflammation to help hopefully package the invader to get rid of it. Leaky gut's a biggie. If you struggle with seasonal allergies, even taking over-the-counter medications and that kind of stuff to help limit the symptoms, I almost guarantee you have leaky gut. So what all of that causes with our ingestion of our diet causing these different things is what I call system overwhelm. Let's just look at this picture right here. If you look at the glass, it should be on the right side of your screen. It's on the right side of my screen, the glass with the least amount of water in it. Let's say that that's what you normally would be as far as your just kind of your overall stress in life. Well, then when you start ingesting these things that cause inflammation and cause mucus production, your glass starts to fill up. Because that's just what's happening. Your body's reacting to it. It may not be clinical. In other words, you may not feel anything, but you have systemic inflammation in you. You're producing more mucus than you should be, and the glass continues to fill up. Well, then when spring comes around, if your glass is that one there on the left, it's already 90% full. When you start breathing in these the pollen from the plants that are blooming this time of year, that's going to fill your glass up and it's going to spill over. That's what we call system overwhelm. So if you can keep your glass either in the middle or the glass on the right, keep your fluid level lower by improving your diet, by cleaning up your diet, like I said, then when you do breathe in those pollen, your glass is still going to fill up a little bit more, but it's not going to spill over. So that's the whole idea of cleaning up your diet. If you can reduce all of the extra inflammation and mucus production producing things in your system. When you do breathe in the pollen, it's not going to affect you as much. And so finally, let's look at our third prong, the supplemental support during periods of overwhelm. Honestly, this step is less effective if you've not done steps 1 and 2. If your nervous system is not turned on and working like it's supposed to, then it's not going to be as beneficial. If you haven't cleaned up your diet, the supplemental support is not going to be as beneficial. So steps 1 and 2 are very, very key. That being said, what supplements do I recommend? Well, first of all, the first 4 supplements are the supplements that everybody needs across the board. Everybody needs these supplements. Number 1, and not in this necessarily any particular order, a whole food source multivitamin. In other words, a multivitamin that has food as its main product, not synthetic vitamins, in other words. Lots of different companies do make those. Again, we can talk about that in the office. Everybody needs a good vitamin D. Different levels, of course. There's not a one size fits all as far as how much everybody's supposed to take. That is individual there, but everybody does need vitamin D. Everybody should be taking a good probiotic. Those bacteria, when they do get in our gut, actually help work with our immune system. And then finally, the fourth one would be omega-3 fatty acid. And the reason for the omega-3 fatty acid, there's a multitude of reasons why everybody needs to be taking it. But one of the benefits to it, in particular with our omega-6 ratio, we need to have a more balanced omega-3 to omega-6 ratio. So if we're eating all of these omega-6s, that ratio is way, way up here. We start decreasing how many of those we're eating, so that level starts to drop. If we can then also raise up the amount of omega-3s that we are eating, we're going to get that ratio a little bit more ideal. Ideal is a 1-to-1 ratio, omega-3 to omega-6 fatty acids. The typical American diet is 40-to-1. So if we can just bring that a little bit closer, we're not going to be producing as much inflammation in our system. Essential oils are a great little tool to have as well. The 3 that really work well with seasonal allergies is lemon, lavender, and peppermint. There's lots of ways that you can get them. You can diffuse them in your environment through a little diffuser. You can actually take them internally. There's lots of different ways that you can do it. Local honey is another way, and it has to be local. You have to buy it local to your environment. Because if you think about it, how do bees make their honey? They go to the different flowers, grab the pollen, they make the honey. Well, that pollen is trapped inside the honey. When you ingest it, your body is reacting to it properly. It sees the pollen and says, hey, I need to do this, as opposed to overreacting to it. So local honey is another good little tool. And also, if you think about it, your nose is a filter. When we're breathing in and out, it's supposed to be trapping some of those allergens in there. If you can clean out it with filters, just think about the different filters either in your home or your car or whatever. You got 2 options with them. Either you replace the filter or you clean it. Well, we're going to clean our filter through saline rinses, nose washes, those different kinds of things. I don't know why that just did that. This is the first time I've used Zoom like this, so I'm glad you're all putting up with me here. So a saline rinse at the end of the day will actually help clean out the allergens as well. There are some specific supplements that I can recommend, but that does come up on an individual basis. I need to ask a few more questions than what we can do through a webinar type setting here. Those supplements are great. I've seen them do wonderful things for patients when they've done a lot of the other steps that we've talked about tonight. So in conclusion, maybe to give you a little bit of encouragement, I want you to picture these 3 wheels right here. We want our health to be rolling. That's kind of what the way I talk to folks is we want a wellness wheel to be rolling. Well, when you look at the structure of these wheels, they all have similar things in common. They've got the outer rim, they've got the spokes there, and then they've got the hub in the very middle. They all are integrally tied together. The hub is the most important part, though, because that's the center. That's what everything spins around. And in our case, in our discussion tonight, the hub of our health wheel is our nervous system. Again, everything has to start with the nervous system. The spokes that are going out from the nervous system, I kind of picture those as the healthy habits that we have in our life, whether it's a good nutritional plan, whether it is getting 8 hours of sleep every night or a good exercise program. The spokes are those different healthy habits that you put into your life to then help support the rim of the wheel. Now, what do you notice about the three different wheels, the one on the bottom and then the two on the top? Well, on my screen, the one on the top left has more spokes than the one on the right, and that one has more spokes than the one on the bottom. The point being is the wheel on the top left is going to be a stronger wheel because it's got more spokes to it. That's the same thing with our health here. The more health habits that you can put in place, the stronger your health is going to be. So, how can I help you with that? Well, actually, let's go over this question first. It's what I call the 5-year question. Are you healthier today than you were 5 years ago? If so, congratulations. What did you do? Because I would encourage you to keep doing that. Second question, are you planning on being healthier 5 years from now? And if so, what are your strategies to make that happen? Don't know what those strategies are? That's where I'd like to help you. So how can I do that? Well, I figure since there's 3 prongs to my approach for seasonal allergies, let's talk about 3 steps that you could potentially make. We can see if you're not a patient, we can schedule you for a complimentary scan of your nervous system so that we can see how well your nervous system's working. Second step, if you're already a patient, maybe we do the leaky gut consultation. It's normally $199. We do it here in the office. It's a 30-minute visit with me. We've got a questionnaire that we go through. We talk a lot about the different recommendations for diet, the supplements that help heal up a leaky gut. Again, for this webinar, I'm going to give you a little discount there, $149, and that's good through April of this year. Third option, maybe you want to try the supplements. So we can do 10% off all supplements ordered through the April of this year as well. And that does conclude my presentation tonight. I'm glad everybody showed up. If you have any questions, all of you know how to contact the office. Give us a call, shoot us an email. You can reply to the email that had the webinar link in it. If you have any questions, we can go that route as well. But I'm glad you stopped in, and I hope you all have a great night.